Dr. Anish Wadhwa. Welcome back.
Good morning.
Good morning. Thanks for having me.
We have to first give you a compliment on the shoes.
Well, the
You
outfit,
always
the
wear,
whole outfit.
Yeah, the whole outfit. We always have. Today we have, what specific pair of the Jordan 3s are these, Doc?
Cements.
Yes, beautiful. A classic Jordan 3. I love it. Well done, sir.
Thank you.
Dr. Wadhwa's eyeglasses are Nike brand.
I love it. Yeah, that's right.
Sponsored. It's my NIL.
That's perfect. Yeah, good Lord. I need an NIL deal. I've heard Division III college athletes are getting NIL deals, Doc.
Different world.
Yeah, it is.
Well, we're hopeful for nicer weather, which would contribute, I think, to a healthier population.
Probably.
Right.
We've been seeing a lot of respiratory viruses and other illnesses this winter.
Yeah, this was a busy winter. I think for a lot of folks who work in urgent care, ER, primary care clinics, there was a lot of volume, and it's stuff that didn't go away. It kind of stuck around for a little bit in terms of the symptoms, at least.
Let's talk about chronic cough. I'm starting to notice kind of around my circle of folks, and I'm starting to wonder, is this a chronic cough or do you just have a cough? But it's something people are dealing with.
Yeah, I think there's specific definitions and things to think about. You know, everybody can get a cold and cough, from whatever reason, the weather changes, or maybe now with the pollens changing in this time of the year. As I've talked about before, it depends on who you are, what it could be. It doesn't have to always be the biggest thing. But even for younger, healthier people, seeing a doctor, maybe you need an x-ray, maybe there's specific treatment. Maybe it's just lozenges and liquids, whatever grandma says kind of stuff. Maybe that could work. It's always a question of saying, if it's not going away and maybe there's something else, do you need to talk about maybe some other additional testing or interventions?
But you got to get it looked at.
Got to get looked at, I think, especially if it's a cup of tea over the weekend didn't work and some rest.
I had a respiratory virus a few weeks ago, and it was the cough that stayed around, and it also kind of came back after what I thought was a week of being better, but it comes out of nowhere.
Especially during the season, in terms of virus season, we think about that as the common precipitant. And so, there are things that you take for viruses in terms of, vaccines and whatnot, but, these things don't prevent those occurrences. So it may not be the illness where you're laid up in bed for the weekend, it's the symptoms that have for the next 2, 4, 6 weeks. There's a specific physiology that can occur where maybe the airways in your lung are more irritated or hyper-responsive, or maybe there's a reflex like kind of cough tickle, I tell patients. And so some of that stuff will get better as time goes on, but sometimes it's really annoying. You can't sleep. You're up at night when you lay down. And so it may not be out and out a big pneumonia or something where you have to go see a doctor in a hospital, but it might be that it's just niggling, persistent, and clearing my throat nonstop
Always
for
there.
weeks and months. Yeah.
Is there like a therapy for this?
If you think about what this could be, first off to say that's not infection. If most of the stuff is a virus and then your body in the, let's say days, weeks, months afterwards, you might be susceptible to another infection, a bacterial infection. That's well known. So maybe if you got better and then something else happened and maybe you have a fever or now a cough that's productive of a color or really significant shortness of breath, maybe you do need to be seen. Maybe an x-ray or at least a face-to-face evaluation might be needed because some things will go away, some things need specific intervention. After that, if there's just irritation, maybe lozenges will help suppress the reflux in the throat, maybe liquids. Sometimes inhalers can help, especially maybe if you have asthma or COPD or something like that, where that will help quiet down some of the responsiveness in the lungs.
I have noticed, my daughter's in 8th grade and I coach them, the amount of kids with inhalers is amazing. When we were growing up, maybe you'd see one kid with an inhaler. Now, it's like half of every team. Are you seeing that? Is that common?
Yeah, I think, we used to always think of allergies or that kind of stuff that happens for kids people who are younger, or asthma kind of symptoms. These things can manifest when you're an adult too. And so maybe it's because we're looking more now.
Yeah.
And we know that these things, it's not that they fix the problem, but they manage the symptoms so the kid can exercise and play their sport. Or someone can go through a meeting without coughing. Maybe they have to take their inhaler. So maybe we're looking more, but now we also know that maybe it's not so much that we have a big problem. Maybe we're trying to fix symptoms a little more aggressively.
Yeah, that makes
and there's
sense.
nothing wrong with that.
I'm hearing about more and more people with sleep apnea.
Yeah.
Maybe it's my age, and as people get older, the more susceptible to it. I don't know, but it just seems like there are more instances.
More people that are dealing with it.
Yeah. Yeah, I have family members. Is there anything new? I know the people, they don't want to sleep with a device.
The PAP
CPAP,
therapy,
yeah.
typical
CPAP.
CPAP therapy.
Yeah.
Yeah, I think it's one of those things, again, in the right person, people who don't sleep well despite having good sleep habits, maybe it's something to look for. And maybe you can talk to your doctor. Maybe we should do a test, or maybe we should work on weight loss. There's a common set of things that we're looking for, especially with people, large net girth, or if they even have weight gain, maybe even specifically. Not everybody necessarily needs to be treated, but maybe you need to talk about your doctor for testing. The new stuff you mentioned, the typical thing is that you wear a mask that pushes pressure in to keep your airway open, and maybe that helps you sleep efficiently. For some people, they don't tolerate these things, and so there's a whole series of steps to go through. For some patients who have weight gain or high BMI, there's new injectable therapies on the market that are used for weight loss that are specifically indicated by the FDA.
Wow.
In our office, we're going to start thinking about how do we screen patients and evaluate patients that are sent from primary doctors to talk about that. It's not the first step, but if we go through the regular things first, maybe that's something to consider for those folks.
What is sleep apnea? What is happening?
Interruption of airflow. I think
Okay.
that's the best way to talk about it. And when you get to your deeper sleep, if there's interruption of airflow, then you don't stay in deep sleep. So think about it as being inefficient sleep. And so you may go to bed at 10 and wake up at 6, but you don't sleep great for those 8 hours. So when you wake up, you're tired, or maybe you have a headache, or you're dragging by 12 o'clock.
People sometimes will look like they've stopped breathing, and it seems like everyone must have that as they sleep, or just, there's a point. What's the difference between that and sleep apnea?
Depends on the person, their size and how they sleep and things like that. There's a decrease in airflow, but it doesn't always mean sleep apnea. But it's very common that people have these apnea episodes, and you're like, wake up, you're not breathing, right? And so I think that has to be part of a few things in terms of symptoms that they have, and then has to be corroborated by a test. So if you're concerned, especially if you're older, have high blood pressure, diabetes, and your BMI is higher, these are the things where you talk to your doctor and say, hey, maybe should I be screened for this to see that this is not something there.
I think you mentioned it multiple times. Your overall health just really can affect these type of issues. So overall, good health is important first.
Common things to talk about with your doctor, and it doesn't mean you have to do a test, but maybe you just got to talk about what do I do next.
Yeah.
Well, we appreciate your expertise and your time. Thanks for coming in.
Thanks for having me. Happy spring to everybody.
Thank you. From Pulmonary Clinics of Southeast Michigan, pulmonologist Dr. Anish Wadhwa. More of the morning show right after this.